All right, Assalamu alaikum and good afternoon, everybody. Thank you for joining us in today's seminar, being jointly hosted by the Social Protection Resource Center and the Health Services Academy, Islamabad. I'm Dr. Mohammed Bilal, and I'm a public health researcher currently working as a research consultant with SPRC. I will be co-moderating today's seminar. We will be starting our event shortly. Before that, I'll go over some housekeeping. So this webinar will be recorded and broadcast live on SPRC's Facebook page. It will be available to view later on SPRC's website, Facebook page, and our YouTube channel. I request all the speakers to kindly keep their mics muted and videos turned off till it is their turn to speak. The floor will open for all the speakers in the Q&A sessions. We will be keeping time to ensure that we keep our schedule of 2 hours. For our audience, we encourage you to post your questions, comments, and suggestions in the chat box. Our panel will address them after the special comments. Now I'll pass the floor to SPRC's Executive Director, Dr. Razia Safdar, to formally commence today's event. Thank you.
Okay, thank you, Dr. Bilal, for orienting us towards this webinar. So I welcome you all on behalf of SPRC and Health Services Academy and CTFK or the Bloomberg Health Initiative for this pre-budget seminar on social policy orientation of tax policies in Pakistan, the case of increasing taxes on cigarettes. This is a very important topic at this moment as we are heading towards the budget on 10th June. So let me make this opportunity to briefly share the objectives of this webinar and subject to be discussed. Globally, tobacco use is the leading cause of the mortality and mainly from the non-communicable diseases such as cardiovascular disease and cancers. In Pakistan, about 19.7% of the adults are currently using tobacco users, and it is estimated that 2 in every 5 smokers initiated cigarette at before the age of 10 years. Smoking, it is a cause of disease, disability, and mortality, and harms nearly every organ of the body. It causes cancer, heart disease, stroke, lung disease, diabetes, and also increased risk of tuberculosis, certain eye conditions, and problems of the immune system, including the rheumatoid arthritis. Exposure to the second-hand smoking is another major concern, as continuous exposure to second-hand smoking can cause the asthma, chronic respiratory problems, and increased incidence of the lung cancer. According to Pakistan Medical Association, at the moment, there are 1.5 million oral cancer cases in Pakistan, with many cases being under the age of 12 years. And the major risk factor for these are the smokeless tobacco. In Pakistan, around 108,800 persons die every year due to the tobacco use. About half of all tobacco deaths occur between the ages of 35 and 69 years. Resulting in loss of 20 to 25 years of the life for the smokers versus non-smokers. According to the estimates of the global burden of disease in 2019, the deaths due to the tracheal, bronchial, and the lung cancers around 60% are attributable to the smoking, and lip and oral cancers and other pharyngeal cancer around more than 40% are attributed to the smoking, and 1/3 of the deaths due to the esophageal cancer are due to smoking. And collectively, smoking is associated with almost 20 types of cancers of different organs, and it is well established risk factor for the vascular diseases at any level, like 25% of the deaths are due to ischemic heart disease, 32% due to the peripheral vascular diseases, and 20% of the cardiovascular diseases in general. So WHO is considering the evidence on smoking as a preventable risk factor to the human health, and to deal with the tobacco epidemic happened in early 2000s. The parties started working in early 2000 and agreed on the WHO Framework Convention on Tobacco Control, FCTC, after exhaustive negotiations and consultations in 2003, and Pakistan endorsed this framework in 2005, realizing the big impact of the tobacco on the health of the people. FCTC Article 6 to 14 are all related to the decreasing the demand of the tobacco, and the Empower is a strategic intervention tool guideline for the countries to reduce the tobacco use by different interventions as monitoring of the tobacco, then guide tobacco use, preventing the people from the tobacco smoke, offering help to quit tobacco smoking, and warning about the dangers of the tobacco and enforcing ban on the tobacco advertisement, and then raising the taxes to increase the price to resulting in the decrease in the demand of the tobacco use, resulting in the decrease in tobacco use. Out of these, raising tax is the most effective and important intervention, as epidemic from the evident from the regional and the international experiences. So the Pakistan has legislation and has improved its tax policy on tobacco, but still at the moment we are not reached to the effective tax level. So today's discussion will be an overview of the work so far done and what can be best for the Pakistan, and to the discuss barriers to implement the already available policies in this matter. As health being the center, and we are honored to, with the presence of the Authority on Public Health and Policy, I would like to introduce Dr. Zafar Mirza, ex-SAPM to Minister. He joined the government of Pakistan as SAPM Health on Prime Minister's invitation, considering his expertise in public health. During his tenure, he was well recognized for his successful strategies to deal with the dengue and then the pandemic COVID-19 as emergency, and Pakistan was recognized globally for its effective and practical interventions to deal with this big international emergency. He was and he is he's the force behind to take the tobacco taxation and health levy bill to the cabinet, resulting in its approval. He has a long list of these services towards the public health in the region as Director of Health System Development at the WHO Regional Office for the Eastern Mediterranean region, and currently advisor to WHO on universal health coverage, for which Pakistan is the first country to adapt DCP3 interventions. He has a long experience of working in social policy at national, regional, and international level at different positions. We are expecting from today's discussion that Dr. Zafar, your insights will be taken positively at the higher policy and implementation level. And at the same time, if you can highlight the main barriers towards the implementation of the previously approved policy. On behalf of Social Protection Resource Center and Health Services Academy, I welcome Dr. Zafar Mirza for this, his thoughts and recommendations. And thank you. Doctor, over to you, Dr. Zafar Mirza.
Thank you. I'm heard properly?
Yes, loud and clear.
Okay.
Yes,
all right. All right. Thank you, Ji. Thank you, Bismillah ar-Rahman ar-Rahim. Thank you very much, Dr. Azia, for your very kind and generous introduction. For the sake of time, we have number of speakers, limited time, so I will be very brief. But let me start by thanking SPRC and Health Services Academy of Pakistan for very timely organizing this pre-budget webinar and giving me an opportunity to share my thoughts and experience with you. I think this is a the kind of civil society contribution that in good societies should happen, and it should be taken into account and it should be heard. So my appreciation and thanks. I'll speak in English because the diction of this subject is in English. So, but here and there I may also speak in Urdu. I believe that we don't have any foreigner though with us. When I was invited to this event, I started organizing my thoughts that what should I say, and from there how to present. And when I looked at the subtitle of this webinar, which is exploring the economics of the tobacco epidemic, public health, and tax revenue, it made me think that do we really have a technical issue at hand or a political issue at hand? And as I will speak more, I will make this point today that I think that we, more than a pure econometric issue, we actually have a political economy issue on this subject. And I think we should approach it that way. We can fiddle with numbers, we can put up and down the graphs, but I think that the real issue, and if we are really interested in making a difference, then we need to take the bull by horns. And it is the political economy of tobacco taxation, and for that matter, tobacco control, rather than just tobacco taxation. And I'll come back to that. But let me first, I have organized my thoughts in three groups. The first is a bigger picture, and I think that is very important to keep in mind that where we stand in the larger picture. Often we start counting trees and we lose the sight of forest where we are moving. So it is very important that we remind ourselves, even at the cost of repetition, what the bigger picture is. Secondly, I will also share some personal perspectives, because I think many of you would be expecting to hear from me that when I was in office, what I did on the same topic, and what is my experience. Very briefly, I will share that. And at the end, I will also make a very important strategic proposal today. Just before the budget, I think it's very important that we become part of the solution rather than just framing the problem all the time and getting into the blame game. I think it is very important also to make pragmatic suggestions that what is possible, what is topical, what would be very relevant for the government to take up as a policy. So let me begin with a bigger picture. As Dr. Razia reminded us very briefly, I think there are 5 facts which needs to be kept in mind when we talk about tobacco taxation, or for that matter, health taxation. Number 1, there is absolutely, and we should not remain in any doubt, and we should not accommodate any such arguments which try to create doubts that actually how dangerous and tobacco use is. In United States, where we have better information, 80 to 90% of all lung cancer is attributable to tobacco use. And not just lung cancer, but number of other diseases, as we just heard from Dr. Azia. Chronic obstructive pulmonary disease, especially, not just lung cancer, is a wide spectrum of lung cancer problems which are attributable to tobacco. So there is absolutely no doubt about how damaging tobacco use is. Second fact, which is also very important, is, and which is also very ironical, is that despite its damaging effect, tobacco continues to be a legitimate product. It is protected by laws. It has given and it continues to enjoy that legitimacy by resorting to very aggressive marketing by the tobacco industry, because it is a legitimate process, despite that it kills, it maims its users. but it is a legitimate product. This is another discussion for another webinar, perhaps, that how we should actually start digging into the legitimacy of this product and how we should actually start work to make it illegitimate product. But that's for another discussion. However, the legal potential of the product is felt world over, and as a result of this, the first ever global treaty for public health was actually created, and that is FCTC, which is a very comprehensive treaty. There are 182 parties to it. In 2003, it was adopted by World Health Assembly, and since 2005, it is in force. Pakistan is definitely is a party to it, one of the founding parties which signed and adopted FCTC. Article 6 of FCTC squarely deals with tobacco taxation issue. And it is said that there's a general consensus that up to 70 to 75% of the total cost that consumers pay should be made up of excise duty and other taxation. Cumulative, it should be 70 to 75%. Despite 182 parties, which means 182 countries and territories which are part of FCTC, it is also a fact, and that is the third important fact that we need to keep in mind, that despite 182 parties, there are only 38 countries today which have actually reached that prescribed level of taxation on tobacco products. The combined population of these 38 countries constitute around about 14% of the global population. Obviously, this discrepancy between the membership of FCTC and the number of countries who have been able to implement FCTC talks loud about the difficulties that countries face in terms of implementing this level of taxation on tobacco. The fourth fact is, and it is very disturbing also, that apart from many countries which are members of the FCTC and which have actually administered, implemented number of provisions of FCTC through national legislation, the tobacco or smoking rates have started going down. In Pakistan, actually, the tobacco and smoking rates are still going up. About 19.7%, which makes about 31 million of adult population, that is plus 15, continues to smoke. And there are actually growing trends of tobacco smoking among women and among younger children, which is also a very important consideration, that when we make choices about social policy in this area, we keep in forefront of our minds that what are the trends. In Pakistan, and this is the fifth and the last fact, it is also very important that against 70 to 75% of tobacco taxation, which must constitute the final retail price of cigarettes, it's only in Pakistan currently, according to a recent estimate, this percentage is 44.7%. So there is a huge gap which still have to be surpassed in Pakistan in order to reach that internationally agreed threshold of tobacco taxation. I think the recent fact sheet which came out from SPDC, the Union, WHO, Vital Strategies, and the Tobacco Free Kids is a marvelous effort, both in terms of its analysis as well as in terms of its timing. So it has very succinctly and very beautifully, it has put together some figures, some analysis, where we stand, where we are coming from, and where we need to go. And timing-wise, it's very superb because tobacco taxation is on the annual, should be on the annual just before tobacco budget. This goes without saying, and I don't need to repeat, very enlightened people are on this webinar, that why tobacco taxation needs to increase. So I will not go into that, those basics. So let me gradually now zoom in on what I said in the beginning, that why it is no more just an economics issue, but why it is a political issue. And as Dr. Razia mentioned in the beginning, that she expects from me to also talk about that what barriers are on the way and how to deal with those barriers. So it's and I think share some personal perspective and experience. When I joined office in April 2019, one of my top priorities was to actually build a case for health taxation or tobacco taxation. And I say health taxation because tobacco is not the only harmful product. We also included the beverages and sugar-rich drinks. And to cut a long story short, I built a case for this. I spoke on one-to-one basis with the then Prime Minister, who did not really need much convincing, to be honest, because being a former sportsman and having worked for the cancer hospital, he knew it all already. And he was very convinced that we should immediately do this, and we should do this in this budget. I also, like yourself, started this work in May 2019. Budget was about to come. So the Prime Minister gave me a go-ahead that please present this, put this on the agenda of the cabinet meeting, present the case, and we will approve it. And so this is what I did. I took it to the cabinet, made a presentation, very forceful presentation, and I was convinced that I think it will go through because Prime Minister is already briefed. To my surprise, even within the cabinet, there were during the Q&A session, there were voices which started talking about the impact on the corporate sector, the revenue generation, the business strategies, and all those, arguments which you don't expect to come at this highest forum from few ministers. But nevertheless, Prime Minister made a concluding speech on the agenda item and said that no, this is a killer and we need to take a very strong action on this. So I personally agree with it, and that's where it all ended in that meeting. And then we took it to the. It was handed over to the ECC, and from ECC it was also agreed at that time, and it was said that it will be included in the budget bill, which was going to be submitted in 2019. Hafiz Sheikh Saab was the finance minister, but since he was not the member of the parliament, so Hamad Azhar, my friend, had to actually make a budget speech. Just before the budget session, there was a parliamentary committee meeting where all the allies and the members of the parliament from the PTI, we had a meeting. A very brief presentation was made about the overall budget outlay. And Prime Minister himself mentioned that we are also going to actually slap tobacco tax in this budget. again, there were one or two voices which were raised, and they were not the voices which you easily ignore. And there was some discussion, and I had to then intervene. I was not heard, so this is very unheard of that I actually, because this was not a meeting which was taking place within the Prime Minister House, it was within the Parliament in a special room where the Parliamentary Committee was meeting. So I had to stand up. Uh, it seldom happens that a minister stands up during a cabinet meeting, but I stood up. And I again made a brief intervention, and I said that this is an agreed agenda from the cabinet already. So the idea of this parliamentary meeting was not to discuss this, was to inform you. So there's no question of reopening this point. And Prime Minister also said that yes, we should go ahead with it. And then the budget session started. They passed, and in the budget speech of Hamad Azhar Saab, he at the very end also mentioned about this. It did not become part of the written speech, but verbally he did mention. And the video clip of that is available, which is also now actually has been translated in English. So and the rules of business is such that if something is uttered orally during the budget speech, it is considered part of the budget bill. And then, this is what our understanding was. And after that, we all thought that now it is done and everything will be smooth after that. But again, it did not happen. Now a kind of rigmarole started between Ministry of Law, Ministry of Finance, and Ministry of Health. And it continued and continued and continued, and it continues today, to date. 2 years, third year have started, 2 years have passed, but this could not be realized. Without going into the details and where we stand today, I think you all know about this health contribution bill, which has been developed now for various reasons, and a number of things happened thanks to a number of you in civil society who continue to raise this issue. But eventually, to date, despite cabinet decision, despite a committed prime minister, the text could not be implemented. And although theoretically billions of rupees have been collected because it was part of the budget speech, but where those billions are and who is taking care of them and how it can be actually used for health is not clear as yet. So the point I'm making here is that it's not just this argument that tobacco kills, tobacco is very dangerous. There is enough evidence globally that more tobacco taxation actually lowers consumption, etc., etc. Everybody understands it. It's a very common sense argument, but it's not just this argument which make government to decide. There are factors other than this argument, or I should say, despite this argument, which are always at work. There are very deep financial interests involved. There are lobbies, even within the parliament, within the governments, which actually continue to work against this agenda. And they wield a lot of political influence that it cannot be ignored. And we all need to understand this. And hence, the political economy analysis of this whole issue is much more important than just econometrics of this problem. And unless this political economy is taken care of and a strong case is built based upon this understanding, mindful of this dynamics, I think we will continue to have problems and we will continue to have bumps on this road. Now, this was the second major point I wanted to make, and the last and very quick point which I want to make is a strategic proposal which I would like to put on table for discussion. I'm also going to very soon, inshallah, write about this also in my op-ed in Dawn, and that is that why it is actually ironically the timing, because of the political and economic crisis that we are facing in Pakistan currently, and because of especially the economic crisis, especially, it is possible for the government of the day to actually perhaps make a decision on higher level of tobacco taxation. Actually, I am arguing that we can go beyond what has been suggested by the fact sheet 22 by SPDC and others. And the reason for that is that we are very much actually keen and dependent at the same time for a bailout from IMF. And International Monetary Fund, despite all the other problems that we have in terms of the constraints that IMF put on social policy and social protection and subsidies of various kinds. Ironically and very interestingly, IMF actually itself has a very clear and explicit position available in black and white that how to actually enforce tobacco excises and tobacco taxation, because it is a good public policy, it's a good economic policy, and it's a good taxation policy. In 2016, the IMF Fiscal Affairs Department came up with a note, which is published, which is a public document, the title of which is How to Design and Enforce Tobacco Excises, which actually goes into the nitty-gritty of the architecture of this policy instrument, which has dual, rather three dividends, very clear. One, it helps in generating revenue. Two, it helps in lowering consumption. And three, it also helps in making more resources available to be spent on health. So at this point in time, I think it will be very smart that we bring in our discussions with IMF as a government, that government is interested to actually raise the level of tobacco taxation in Pakistan in order to generate more money, because we are in a we have a fiscal problem, we have a economic meltdown, and I think that this will be a great, it can be a great discussion point and a possible solution to overcome the political dynamics that we have and the political influences and pressures that we have, to actually bring it into the heart of our discussions with IMF and actually go much beyond than what has been proposed earlier as tobacco taxation. Obviously, time does not permit to go into the further details of this proposal that I'm making, and I'll be soon, as I said, be writing about it. But I also want to actually put this on the table through this webinar in front of all of you to also think about it, dig deeper into it, and campaign for it with the government. Thank you very much, and I'm sorry if I have taken more time than allotted. Back to you.
Thank you, Dr. Zafar Mirza, for your concrete and valid, relevant insights and recommendation, which can be taken as at a higher level. And so this has raised many questions on the political economy of the tobacco. and which needs to be a better balance between the health tax revenue and the private profits on one hand, and the gaps at the implementation side at the different years on the other hand. As it makes, is it a mark of not so motivated attitude towards the professional social policy goals? We are hoping to explore these issues at this important webinar with a view to grow a consensus on the way forward on this issue of the national importance. Thank you, Dr. Zafar Mirza. And now we move further, and I invite Mr. Mohammad Javed, Director Planning, Ministry of Law and Justice, Government of Pakistan. Welcome, Dr. Javed. And let me take this opportunity to welcome our esteemed guests from Ministry of National Health Services, Dr. Samra Mazhar. She has joined us, and Dr. Shehzad, the Vice Chancellor for Shehzad Ali Khan from Vice Chancellor as the Health Services Academy, and Mr. Mohammad Javed. Mr. Mohammad Javed is Director Planning at, and he will talk about finding a balance between optimum tax and employment and revenue and employment and the health. Mr. Mohammad Javed is currently Director Planning at Ministry of Law and Justice, Government of Pakistan. Previously, he was National Technical Focal Person to FCTC, Secretariat Geneva, and member of implementation international working groups on FCTC reporting arrangements. Mr. Mohammad Javed was the former project manager at Tobacco Control Cell and former deputy project manager at World Health Organization. So he is surely the most knowledgeable expert on the tobacco control in Pakistan. Over to you, Javed Saab.
Thank you so much, ma'am. Thank you so much for inviting me and providing me chance to participate in this pre-budget seminar, rather webinar. And thank you so much for your kind words. You have introduced me. Assalamu alaikum, Dr. Zafar Saab, because Dr. Zafar Saab was my minister when I was in health ministry. So I have learned a lot from him. I have a small presentation, 10 minutes presentation, so we can recap these issues. So my presentations will be on obligations, economy of smoking, and what could be the best options for budget with respect to tobacco tax policies. This is my favorite slide. That basically I want to show that the population under 25 in Pakistan is around 63%. That's why tobacco industry is so much focused in this region, because they are targeting youth to sell their products to increase their revenues. In Pakistan, about 450 people are dying every day due to tobacco use. And we have the international obligations that is related to this, that is FCTC, as Dr. Zafar Mirza mentioned, and two specific goals which are directly related to the tobacco control issues. And one is goal 3.4 to reduce 1/3 premature mortality from NCDs, and other is to strengthen FCTC. And in FCTC, the Article 6, which is directly related about the taxation. If you see the SDGs, although the SDG 3 is directly related to the tobacco control issues, but if you see all SDGs, only 2 SDGs which are not directly related to the tobacco control, and other 15 are somewhere directly or indirectly related to the tobacco control. So tobacco control impacts on all these goals. If you see the economy of smoking in Pakistan, that's a very alarming figures, that 231 million cigarettes are consumed per day in Pakistan. And if you calculate it annually, you see it's around 87 billion cigarette sticks, huge. And if you see the amount, you can say that are being spent on this is about 347 billion rupees. These are spent on cigarettes annually. And this is the most relevant. When I was working in tobacco control cell, we had a figure of 140 or 150 billion rupees. We didn't have the local study. Now we have the local study. That is 650 billion rupees. That is the total health cost of smoking that we are bearing. These are direct or indirect costs. And if you just compare it, what we are getting from the tobacco industry as sales and excise tax, or you say tobacco tax revenues, you see the amount spent on these, that the health cost is about 4.5 times of the revenues generated from the tobacco industry. It's huge. This is a relevant latest study which Dr. Zafar Mirza was also mentioning. SPDC and some other our international partners, they have conducted this study in Pakistan, and thanks God we have the local study now. If you see the growth in per capita income in last 3 years, so basically it was 12.7% in 2021, and then it was reduced, and now it's increasing about 11.5%. And inflation, if you see the inflation, it was 9.7% in 2021. And if you see the other forecasts in 2022-23, it's about 7.3%. So its inflation is decreasing basically. And if you see this affordability of cigarettes, that is calculated on basis of formula, that is relative income price ratio, defined as the percentage of per capita GDP required to purchase 2,000 sticks of cigarettes. So it was around 4 in 2021 and 3.6 in 21-22, and it's forecasted that in 22-23 it will be 3.2. This means cigarette will become more affordable in next year. This is alarming. And this is the universal truth, and research has also proven this, that if we increase the taxes, and we will decrease the death and diseases due to this increase in taxes. This is the current situation in Pakistan that I want to explain this. I have this data from 2016 to 2017. You see, at that time, there were two-tier structure in cigarette packs about taxation, with respect to taxation. And then in 2017-18, you know, they have manipulated some policymakers, they influenced some policymakers, and a third tier was introduced. And this was disaster for the taxation, tobacco taxation, cigarette taxation in Pakistan. And then this continues to for 2 years in 2017-18 and 2018-19. And in 2018-19, in tobacco control cell, at that time we were working, we had calculated every figure that due to this decrease in taxes or introduction of this lower tier, the cigarettes have become more cheaper, affordable for the smokers, and we had calculated that there were new entrants in smokings, and also the production was increased at that time from 39 billion sticks to around 60 or 61 billion sticks. So it was drastic increase in cigarette production. So thanks God, we were able to convince the policymaker to restore the two-tier structure in 2019. And in 2019, there was substantial increase. If you see the lower tier, that was tax was increased from rupees 25 to 33. And in upper tier structure, the federal excise duty was increased from 90 rupees to 104. And since then, if you see the last graph, from 2019 to 22, in last 3 fiscal years, the duty or the federal excise duty remains the same. Although there is inflation of 7 to 8% and 10%, but even they have not adjusted the inflation, and the federal excise duty remains the same. And some years back, there were two kinds of excise duties that they were imposing. Federal Board of Revenue was imposing. One was specific tax, specific rupees that is collected on cigarettes, and other was ad valorem. So then they had removed the ad valorem component. Now there is only specific excise, like on a cigarette of 20 packs. This is calculation is based on the cigarette of 20 cigarette sticks. Now there is in the lower tier, their federal excise duty rate is rupees 33, and in upper tier, there is a federal excise duty is of rupees 104. And then in addition to that, there was 3 rupees per cigarette pack of 20 that was filter rod duty. And then there is 17% VAT. So by this formula, the total price of cigarette packs is calculated. If you see the cigarette brands shares, you know, there are 2 types of brands. One is in lower category and other is in upper brands. So lower price brands are around is 88% market share. They're having 88% market share. And the upper brands were having at this time is about 12 or 13%. And you see when there was 3-tier structure, you see the cheaper brands contribution or market share was higher. It was around 93%. If you see the tobacco tax revenues, what we have collected from the tobacco industry in last 10 years, this is total figure. Like if you see in 2018-19, that was 114 billion rupees. This is federal excise duty plus sales tax. The total tobacco tax revenues collected from the tobacco industry. And in last year, it is reported that they have collected 135 billion rupees from the tobacco tax from the tobacco industry. But despite this, if you see the economic cost of smoking or health cost of smoking, that is 615 billion rupees in Pakistan. That is about 4.5 times more than what we are collecting from the tobacco industry. If you see the tax increase in last 2 or 3 years, I've just compared from 2019 to 2020. If you see the lower graph, you know the federal excise duty remains the same. In 2019, it was same on both tiers, and then in 2020, it was same in that year, and same was in 21-22. So since 2019, there is no increase in federal excise duty. Even I'm repeating, they have not adjusted the inflation rate rather than increasing. In 2021, some changes were made. Like in unmanufactured tobacco, they have imposed 10 rupees per kg. Then on cigarette cheroots import, they have increased custom duty from 65% to 100%. And before that, there was rupees 0.75. That is rupees 1. They have increased cigarette rod tax from 0.75 to rupees 1. So this is basically this. Its impact was first we were collecting about 3 rupees per pack. That is increased to 4 rupees per pack. So 1 rupee per pack was increased as cigarette rod tax. And this remains the same till last year. According to the latest research published by the SPDC, this is quite good figure. So I am just repeating that one, that if we increase the federal excise duty from current rate, that is rupees 33 to 42.9, around 43. So it will be substantial increase. So after increasing this, we can get the excise share of lower brands or lower tier about 49%. And if we increase the federal excise duty from 104 to 135, that will be excise tax share of the upper slab would be around 64%. But as a whole, if we calculate, it would be around 52%. And WHO recommended it no 75% of the retail price. But some countries are calculating after adding the VAT in it. I have seen the Turkey model, I have seen other models. They have calculated it on the basis of final cigarette price. That is include retail price plus VAT. So if we just add VAT in it, then we can reach around 60%, 59% or 60%, although we are far behind from the WHO benchmark. But this is good policy option which could be considered in upcoming budget. And the impact of this one, you see, we can reduce the smoking prevalence by 1.2%, and we can save around 71,000 or 72,000 lives due to tobacco use. And parallel to this, So we can increase around 27 billion tobacco tax revenues. So it's basically win-win situation for all if we implement this model. I think so. This is a good model which they have basically proposed. With that, as Dr. Mirza Saab said, at that time we had calculated that if we put the health levy, so this is also a win-win situation. Like around 3 billion packs are being sold legally in Pakistan. If we just put 10 rupees per pack as what we call the name health levy, health tax, but no, health contribution bill is a bit different from this concept, you know. Then we can calculate around 30 billion annually. And from the sugary drinks, if we just impose ₹1 on 250 milliliter bottle, that is 4 rupees per liter, we can earn 8 billion rupees. So we can get 38 billion additional rupees from this health tax or health levy. More parallel to this, you know, there are few exemptions. When we are discussing that we should increase taxes, we see in our Excise Act that there are few exemptions that are given to Navy, President of Pakistan, President of Azad Kashmir, and governors. These exemptions should be removed immediately. That should be our proposal. Beyond 2022-23, there are some proposals. They have also recommended that we should progressively increase the taxation and makes the cigarette less affordable. And we should also adjust inflation. You know, even they are not adjusting the inflation. And we should also impose uniform federal excise tax duty rather than dividing into 2 slabs or 3 slabs. And this tobacco taxation and excise taxation should be imposed on all tobacco products. From the law and justice point of view, you know, we had received this bill. And first question which were asked from the Ministry of Law and Justice that federal government can impose this health tax or health levy or not. We had a good discussion here, and we had cleared that bill that federal government has a mandate to impose this health tax or health levy. And second question was that should it be introduced as money bill or an ordinary bill can also be introduced in the parliament. So last time we have vetted that bill, and we have also given the comment that an ordinary bill can also be introduced for this health tax. Even an ordinance can also be promulgated for imposing of this health tax. So it's not the mandatory requirement that under Article 73 that it should be the money bill. We have cleared this one from the Ministry of Law and Justice. No, according to the rules of business, it's upon the respective division. Whether Ministry of Health will introduce this bill or FBR or Revenue Division will introduce this bill because it's their mandate. But we can only vet that bill. We can see that it's according to the Constitution and local laws or not. We have also cleared that one in last year. So it's upon the relevant division whether they can introduce no or not. But it should be introduced, I think so. Okay, this should also be a recommendation through this seminar. Thank you so much. If someone has the questions, you may ask according to the agenda. By the end of this session, or as Dr. Razia Safdar can recommend. Thank you, Dr. Sabha.
Thank you, Javed sir, for a very informative and a really insightful presentation. Now we have Mr. Khalid Mahmood Saab, ex-Director General Customs Intelligence and ex-Chairman Sindh Revenue Board, Karachi. He has joined us, and he's a very senior and experienced officer from the FBR who served at very senior positions both at the federal as well as the provincial levels. He has been a DG Custom Intelligence and led the Sindh Revenue Board for 5 years. And during which time he transformed the organization and made the Sindh Revenue Board as the most successful and effective provincial revenue authority. Khalid Saab joined Pakistan Customs and Excise Group in 1982, and in his long career spanned over around 40 years, he worked on the progressively important positions within the sphere and outside. So I invite Mr. Khalid Mahmood for his insights as a valid keynote speaker. And over to you, Ms. Khalid Saab.
Very good afternoon, and thank you so much, Dr. Saba, for your very generous introduction. I understand I have missed some of the very useful presentations. Is there some problem? Am I audible?
Yes, loud and clear, please.
Yes. Okay.
But your
And I have
screen
also,
is
please, yeah, were you saying something?
kindly readjust your screen, please.
I'm trying to. Sorry for the inconvenience, but
कैमरे की साइड अपनी तरफ कर लें. हाँ जी.
is it okay now?
अब ठीक है.
Actually, and I understand I have also missed very valuable comments from Dr. Zafar Mirza. As regards the case for increasing the duty and taxes on cigarettes, I have some other dimension also of this particular problem to discuss and to highlight particularly. According to the data that I have got, about 81 billion sticks are made annually in Pakistan, and 55 billion sticks are subject to duty and taxes, and about, say, easily 25 billion or so are outside the domain of taxes in Pakistan. So the total collection this year will be 155 billion from the, and only two companies will be paying about 152 billion, which means that 3 billion rupees would be paid by rest of the companies in Pakistan. 35% of the total cigarette trade in Pakistan is constituted by illicit trade, which includes duty non-paid component as well as the component coming from the inflows coming from smuggling into the country. So I have been associated with the taxation issues of cigarette industry and have some background of the industry as such also. So my concern would be that if we go for a case, say increasing the taxes on the industry or the cigarette products without really taking into account the issue of duty non-paid component, then perhaps we would be incentivizing the illegal regime which exists in this industry. So while we move a case, while we try to make out a case for increase in the duty and taxes, we should also be looking into that particular aspect of it. So, I would be suggesting that while we talk to the Federal Board of Revenue and now Ministry of Commerce also, which also has a role in taxation in Pakistan. So, but we should also be talking to the law enforcement agencies in Pakistan as well as in Azad Kashmir, and we should moving in tandem also. We should be ensuring that while taxes are increased, the duty non-paid components inflow is also not increased in the country. This has been a problem, a very chronic problem in Pakistan since the onset of transit trade, which has largely been taken care of by putting the cigarette into negative list. So it's the smuggling component is only 2%, but the most of it, the rest of the 33% is the local component. So there are factories in some areas of Pakistan which do not really take care of their legal obligations. Now that the FPR has improved track and trace system, it's just open to debate how far that will be effective also, because the companies which are located in remote areas, which have been escaping so far the vigil eyes of the law, would not be very obliged to ensure the implementation of this system also. There would be excuses to be mentioned, like there is an outage of, say, power in that particular area. So 100% enforcement, of course, will be ensured by the two companies which constitute, say, the 65% of the legal trade in Pakistan. So the 65% of the total trade in Pakistan in terms of the market share. So I think track and trace system will also be required to be effectively and equally on robust basis to be introduced to those particular manufacturers also. So that is one thing, and my view is that if we go for a case, if we try out a case only for the increase of duty and taxes, while not taking care of the enforcement dimension of it, perhaps the purpose of the levy or purpose of the increase in taxes would be frustrated to a large extent, because then the trade will further go into, say, the non-duty paid component as well, and it will only incentivize that particular sector. So we need to sit with the revenue authorities as well as the enforcement authorities within the 4 provinces of Pakistan, and then of course AK as well, to ensure that enforcement side is also taken care of while we plead a case for increase in duty and taxes. So this is what I have to say at the moment. Thank you.
Thank you, Javed sir, for very concise and brief presentation and insights. And now we have with us Dr. Ikramul Haq. He is an international tax lawyer with long experience in taxation. And he is ex-civil servant and has in-depth knowledge of policy making and practices in the public sector taxation. So he is a special guest for a brief comment for 3 to 4 minutes, and we invite him for this comment as he has to leave for other meeting. So over to you, Dr. Ikramul Haq Sahab. Thank you.
Thank you very much, Razia. I have been very pleased to see your efforts. I have been privileged to listen today to Zafar Mirza Saab, to Javed Saab and Khalid Musa. 3 issues are very important to be highlighted. First is that, of course, how we can control this illicit cigarette trade. Because all our efforts ultimately, whether in the form of taxation or health tax, will be frustrated unless we have control over entire trade. When a whole cultivation of tobacco can be calculated and monitored, then how it is that even 4 or 5 green thrash units cannot be properly monitored. A long time ago, we have been writing on this subject that this is the issue where all the wholesalers, manufacturers, and retailers are in fact in one supply chain. So we should try to understand that where the periphery is, where the actual hole is, and we should try to plug that. And for that, we need, of course, very strong enforcement. IPR people know it very well, and unfortunately, they know where these units are. There are specific rules for monitoring of these units, but unfortunately, it has not been done. Pakistan Tobacco Board is the authority that has to authorize that how much all manufacturers need to manufacture cigarettes. So that is the starting point. We should know that each manufacturer, whether it is duty paid or non-duty paid in the country, they must be registered and properly monitored to show that how much tobacco they purchased and how much manufacturing they have ultimately shown. Because it's basically a health issue. So rather than only emphasizing the revenue side, we should also take it in the spirit of how to take it as a national health issue. So most of the time when we say it is more revenue to be generated, obviously duty should be according
I think there was an issue with the internet at Dr. Ikramul Haq's side. So let me move forward and we can connect with him again. And then I would like to invite Mr. Imran Malik, who is head of campaign for tobacco-free kids in Pakistan. And he will speak about, he will give an overview of the evolution of the tobacco economics in Pakistan. Mr. Malik Imran is currently the country head and advocating for the enhancement of the tobacco taxation mainly and other components of the Empower strategy implementation in Pakistan. Malik Imran Ahmed is a master's in international commercial law from Oslo University, Norway, MBA in project management and holding various professional certification, national and international. He is a senior professional in legal sector, having 20 years of experience in international law, contracts and arbitrations, legal education and capacity building. He worked as a deputy head of director law at South Arbitration Council. He managed USA training program in Pakistan as deputy chief of party. Okay, so over to you, Mr. Mira, but for a moment, Mr. Ikramul Haq is back and let him finish and then over to you. Thank you.
I'm extremely sorry that I lost the connection, but I was just saying that we need a holistic approach and we should cover all the areas. Since my meeting is only 1 minute away from now, I would love to share my and Hosama's published work on this subject, and hopefully in the next webinar, we will be able. I wish all of you very best, and our services are always available for this cause. Thank you very much.
Thank you, Dr. Saab. Over to you, Mr. Imran Malik. Imran Saab, are you there?
Hello, Assalamu alaikum. Can you hear me now?
Yes, we can hear you now. Please
Okay,
go
sorry
ahead.
Yeah, thank you very much. And thank you for inviting me in this very productive session, which is, which reflects a lot of opinions and a lot of data that was unknown before this. And I think this will definitely help us shape our activities to make sure that the government can be convinced to increase tobacco taxes on tobacco and cigarettes and other products that are related to tobacco to save our future. I will just give you an overview of how and why this tobacco industry should be in Pakistan. I have heard from some gentlemen about the illicit trade, and I will explain what the illicit trade is and how it is being used as a tool by the tobacco industry to ensure that the tobacco taxation is not increased. Let me share my screen with you so that I can share the presentation. Here you go. Okay, can you see my screen, Dr. Razia?
We can see.
Yeah, thank you. So we need to know exactly why should we have a sustainable tobacco control policy.
Malik Saab, can you make it a slideshow?
Yeah,
It's
yeah,
not
I have already done that. Yeah, can you see it now?
Yes.
Right. Okay. So let me go through some data which has already been discussed here. I don't want to go into detail of this. We know the prevalence of tobacco use in Pakistan, and we also know that the children between the age of 13 and 15 who use tobacco is 10.7%, which is quite alarming. And I have heard Javed Saab mentioning that we have a huge population of youth in Pakistan, and that is why the tobacco industry is investing more in this part of the world, because they know that there are huge customers present in Pakistan and India and Bangladesh. But we have to see a broader economic perspective of tobacco industry in terms of youth, our health, the poverty that they are creating, and the economy that they are messing with in Pakistan. Just to go through the youth, we see that tobacco industry, one of the document of Philip Morris in US regarding the enhancement of their products has mentioned children as replacement customers. Why they want the replacement customers? Because there is a huge amount of people dying every year. In Pakistan alone, there are 170,000 people die every year in Pakistan because of tobacco. Now compare it with COVID. I mean, there are hardly any thousand of numbers of people who have died in the last two years of COVID pandemic. But we are losing 173,000, and through tobacco industries media, this figure has never been, give any alarming, things or thoughts in our policymakers. But to replace those 173,000, they need people who are replaced, and they see children as part of their strategy to replace those customers, because then they will have a long-term customer in their belt. We see that when before making the single sticks ban in Pakistan, we had an opportunity to survey India, Pakistan, Bangladesh, and Sri Lanka through a survey called Tiny Targets, and we saw that 214 out of 215, that is 99.5% of the kiosks that has been visited, they were selling single sticks, although they were banned. After that, they were banned. Why single sticks? Because tobacco industry want to make sure children are buying it, and these are the easy product if they are sold singly for the children. We also saw that when we were going from 40% of health warning to 60% back in 2015, the tobacco industry used all kind of pressure on the Minister of Health at that time to stop it from being implemented for 85%. But eventually, through a very long legal battle, we were able to get this 50% first in 2018 and then 60% in 2019. But even after that, the tobacco industry has put a lot of legal as well as other challenges for the Ministry of Health and for the activists on tobacco control to stop from enhancing the pictures on the graphical health warning. Why they don't want to have a more picture area on the cigarette packs is because the chronic smokers do not actually care about the picture that is on the tobacco or cigarette packs. But it is the children who actually see this, and they feel disgusting, they feel some kind of a danger on it, and they are protected. Who want to start smoking, they are the most person that can be impacted through the enhanced graphical health warning. on the cigarette packs. But if you see the beauty of the cigarette pack, the tobacco industry want to make sure that that beauty still remains. This is one of the tools that has been mentioned by the FCTC to reduce consumption throughout the world. And unfortunately, if we see, we are the least, the lowest country which has the smallest graphical health warning on cigarette packs. Nepal, India, Sri Lanka, all have gone way beyond our graphical health warning size. It was, and it is highly ironic that, when Pakistan declared that they are going for 85% of graphical health warning, India immediately copied it and they have implemented it. But we, because of the tobacco industry's pressure, we remained at 40% at that time. And only after the legal battle that we were able to get it 60% in 2019. And after that, it is still there. Tobacco industry also used different tactics on social media through a campaign called Battle of Minds throughout the world, wherein they, attract youth to make sure that, their product is popular among the young ones in Pakistan. So you see, tobacco industry is destroying our future by targeting our children, our youth in Pakistan. As far as health is concerned, I think it is a general consensus throughout the world that how tobacco is affecting our health. It kills 170,000 people every year in Pakistan, and 5,000 people are admitted in hospital every day. This is these figures are only for Pakistan, and we know that globally the figures are much alarming. So they are destroying our health as well. Now we come to the poverty. There is a survey by WHO which says that tobacco and poverty remains in a vicious circle. So as long as the household that use tobacco or their main bread earner is using tobacco, there are more chances that that household will go below the poverty line because of various reasons. Because tobacco, not only consumes a lot of resources which can either be otherwise be used for basic food, health, education for the children, and other things which are more productive. And when this person who is the bread earner becomes sick or ill because of the tobacco, the savings of that household, they are all consumed in making sure that that person gets the health care which is otherwise not available very cheap in Pakistan. So according to the survey, 25.3% of the household in lower income group, they smoke cigarettes, and they spend 10% of their average monthly income on cigarettes. This is creating a lot of problem for the people who are below poverty line. And in Pakistan, there are huge numbers of such people in Pakistan, which is a big hurdle for any effort that the government of Pakistan is making to bring those people above the poverty line. So we also see that tobacco is contributing towards poverty and malnutrition in Pakistan. Yes.
Malak sir, may I interrupt you? Your screen is not moving. I think we can see only first slide.
Okay. I don't know why it's not moving.
Kindly, please. Anyone else is?
Malik Saab, may I suggest you stop sharing your screen and then start sharing it again? Maybe that will help.
Okay. Okay. Let me do it. Can you see it now? Sorry.
Yes, we're on the first slide. If you could now start the slideshow.
Sure, let me start it. Bilal sir, is it fine now?
Malik Saab, we can see your slides moving now, but we don't see the slideshow. I think it should be okay. Kindly,
I will go back and we'll stop slide share, right?
Sure, whatever works.
That's good now?
Yes, fine. It's moving now. Thank you.
I think slide share is making some problem. So let me do it like this then. Okay. So I was mentioning that the relationship between tobacco use and the vicious circle of poverty. So if you see smokers spend 10% of their average monthly income on cigarettes, and these smokers are from the lower income group in Pakistan, which is a huge number in Pakistan, because and all the efforts that the government is doing to bring those peoples above that poverty line is failing because of one big reason, that they are using tobacco, which is otherwise draining their resources. If we see the economy, that is the most important part of this conversation today. You see, I think Dr. Javed Saab has mentioned that the tax rate is 119.20 rupees on the upper tier of cigarettes, and then 104 rupees, and then 33 rupees for the lower tier. Lower tier are the cigarettes which are below 119 rupees of the market rate. And we see that the tax FED collected in 2019 and 20 was 110 billion, and I have heard that it is now 135 billion plus. This includes FED plus sales tax. But one important thing that we need to understand is that this tax rate has not been changed in the last 4 years, since 2017-18. We had the FED rate on cigarette pack of 20 cigarettes, that was 32.5 rupees. In 2019, when the third year was removed, it was back on 33 rupees. And ever since, it is 33 rupees, although we all know that all the other commodities which are essential for anybody in Pakistan, they have their prices have risen to double and triple. And in terms of dollar, if we see the dollar rates, actually the tax rate has decreased. And I think Dr. and Javed Saab has rightly mentioned, the tax rate has not been according to the inflation that we are facing now in our country. So the tax has actually decreased from $0.31 per pack of cigarette to $0.17 per pack of cigarette. And this figure is also important to understand the illicit trade narrative of tobacco industry, because when you say there is an illicit trade in Pakistan, which is duty non-paid cigarettes, there are two ways that can happen, two big ways that can happen. One is that local industry produce it and then sell it in the market without paying taxes, and second is the product comes from abroad. But we know that the tobacco rates, cigarette pack rates, are lowest even in the region. India, Bangladesh, Sri Lanka, Nepal, and even in Afghanistan, the rates are much higher. In Pakistan, they are much lower. So there is no chance that the cigarette packs are coming from abroad. And the ones that are coming, they are from the higher tier. So the most sold brands are not smuggled into Pakistan. So this is one dimension we need to understand. But the other thing is that false illicit trade argument by industry is based on one report that they always produce and give it to the government, which is a CNISA report, wherein they mention that it is 40% of illicit trade. But just give you a hint that this 40% argument is not only used in Pakistan, the same argument is used in other parts of the world where the tobacco industry is working. Now we have to see who are the major players in tobacco. So we have heard that there are some local industry which is not paying. We know that the local industry seldom pays tax on their product, and they should also be brought into the tax net, but their market share is less than 10%. And there are two big companies who are producing in Pakistan. Their market share is 90%. And this has been demonstrated by the Bureau of Statistics and the Federal Board of Revenue documents. When some independent surveys were conducted on illicit trade because of the argument that was developed by tobacco industry, it was revealed that the total volume of illicit trade in Pakistan is not more than 16%. It is between 10% to 16%, which was endorsed not only by FCTC, Ms. Hannah Ross, who has also conducted a survey in Pakistan, but also by the Federal Board of Revenue in a private conversation with us. So we also believe that this is actually the real figures that that are there out in the open. We also know that if you go into the arguments that the tobacco industry was developing back in 2021, there's industry was saying that there is 44 billion rupees lost to this economy because of the illicit trade. And all of a sudden, when new report comes that there is a 650 billion rupees lost to the economy because of cigarettes, the tobacco industry started propagating that, you know, the loss of economy because of illicit trade was 77 billion without giving any survey or data to back their arguments. We know the SPDC, one of the think tank, they have conducted a analysis based on the data that they have received from FBR and Bureau of Statistics and the State Bank. They come to the conclusion that tobacco industry, the two big tobacco industries, they were underreporting up to the tone of 47% of their products, which amounts to rupees 37 billion lost to the exchequer because they were not paying tax. And where those whole 47 or 26% were going, they were going into the market as non-duty paid cigarettes. So these industries were involved in putting the duty non-paid products in the market. This is why I'm saying this, because the tobacco industry has never, these two industries have never registered a single case of copyright to any other person who they thought that they are claiming that they are producing the copyrights of their products. So where does this go? It goes into the market, as we see from the survey that SPDC has conducted. And one important thing that happened last year was tobacco industry spent some 1.2 billion rupees in Pakistan to run a campaign called Better Pakistan, using the celebrities to enhance their argument around illicit trade. And we have, analyzed that propaganda campaign by tobacco industry, and we countered that. But definitely, tobacco industry had more money to convince people through the celebrities. So we see that because of the tobacco, there has been a survey by PIDE, Pakistan Institute of Developing Economies, which says that because of tobacco, every year Pakistan loses 615 billion rupees, or around $3 billion every year. So we are, asking IMF and other countries to give us just 1 billion rupees, and we are losing 3 billion every year because of the smoking that we are prevailing. Despite all this fact, all the narrative that the tobacco industry is building on illicit trade, if we see the profits, the net profits of these two tobacco companies in Pakistan only, we have only see the consistent increase in their net profit, which shows that there is hardly any damage because of the illicit trade and because of the volume that they are, propagating in Pakistan. So they are consistently earning a lot of money and then draining all this important foreign exchange out of the country, leaving death and destruction in Pakistan. So tobacco industry is devastating our economy already. We see that we have a negative economic impact of tobacco, negative health impact, and we have negative social impact because it increases in anxiety, stress, poverty. It damages our environment as well because they have to cut a lot of tree in order to cook the raw tobacco. So they are actually causing a lot more damage to the environment than to the health of the people. So tobacco is also not a necessary commodity for any reason. And if I remember during the COVID, when there was a lot of ban on the production on a lot of industries because of the complete ban on due to COVID, we saw that in KP, the tobacco was included in the necessary commodity and was allowed the production even during that period. So they have a lot of political connections and a lot of clout within the policymakers. So back in 2017, as Javed Saab mentioned, there was an introduction of third tier, which actually reduces the tax rate on the most sold brands to half, from 32 to 16 rupees. And this is a document that we have got from the State Bank, which shows the huge rise in production of tobacco products, 90% jump in their productions. And of course, eventually that will be sold and consumed in Pakistan. So we see that the price has a very, very direct impact on the production and consumption of cigarettes in Pakistan. Even World Bank has said that, if Pakistan want to reduce cigarette consumption in Pakistan as per their agreement with the FCTC and want to generate more revenues, Pakistan should increase at least 30% of taxes on cigarettes every year. And this is also the recommendation that, CTFK, WHO, and Union have together developed a concise recommendation report for the government, and we have submitted it to the government of Pakistan through various ministries. We know, based on that model that we have prepared along with WHO, it was suggested that if we increase 43 rupees on the low price tier cigarettes and 135 rupees on the top tier price cigarette, Pakistan will be able to get 200,000 few smokers. We will get 1.2% reduction in smoking prevalence among adults and 71,900 lives saved every year and 27.4 billion rupees in additional FED revenue on top of 135 that we are. This is still very less as compared to the damage that tobacco is causing to the economy of Pakistan, but still we will have a lot of earning, and the main dividend will be the lives that will be saved. Pakistan should act now. We are requesting the government of Pakistan to adopt the National Tobacco Control Policy Framework, which is under discussion in the Ministry of Health. We want the government to increase federal excise duty by 30% and impose the health surcharge. We must remember that 1,200 Pakistani children between the age of 6 and 12 start smoking every day, and this is their target. This is the target of tobacco industry. We need to shatter their designs to destroy our youth and economy. Thank you very much. Dr. Razia.
Thank you, Imran Saab. And now we move further, and I invite Dr. Safdar Suhail. He is ex-Special Secretary Cabinet and presently Dean, National Institute of Public Policy, Lahore. He will speak on impacts of high taxes on smoking in the light of regional and international context. So he is a PhD in sociology from France. In his civil service career, he spanned over 35 years. He served in various capacities, combining traditional jobs as Ministry of Commerce officer with policy research training of civil servants, and then governance reforms, trade diplomacy. To mention a few, he was founding Director General of CPEC Center of Excellence at Planning Commission. He was Pakistan Economic Minister to European Union and Member Governance at Planning Commission of Pakistan. He is part of many national and international forums on trade, public policy, social policy, and being committed to reform and development. He established Social Protection Resource Center, Islamabad, to complement the ongoing efforts of positive social change in the country. So I'm delighted to request Dr. Safdar to give us an international and regional overview of impact of tobacco taxes on smoking. Over to you, Dr. Safdar.
Okay, thank you very much, Dr. Razia, for the kind introduction. And as you mentioned also, SPRC, with a lot of friends, with a lot of passion, we started this initiative. Social Protection Resource Center stands for the universalization of social protection in Pakistan, and health social protection obviously is one of the key pillar of the overall social protection architecture in any country. I'm so happy to have all the participants and all the guests, Dr. Zafar, Khalid Saab, Dr. Shahzad, Dr. Samra, Malik Imran Saab. Thank you very much for an excellent presentation. Javed Saab also. I think by now we must already be wondering that in the presence of all that evidence, why do we still need more evidence? I mean, I was going to share the regional and international experience, which I still will very quickly because we are running short of time. But I think, as Dr. Zafar Mirza has said, that we need to look beyond the economic and econometrics. Governance is one issue which is there with, even if the right choices in terms of policy are made, governance could be a problem. Just look at the example of this trace and track system. We were confirmed by a gentleman from Regional Tax Office Peshawar had confirmed to participate in today's session, who looks after the trace and track system. But he is right now in an investigation. He may join or not, but he told me that the system is not yet installed, the machinery in most of the units. So that is a governance issue. But the main concern, which is the topic of the webinar also, is to reflect on the social policy orientation of Pakistan. Now, social policy orientation can be gauged in a country by social policy financing mechanisms, as well as the institutional performance. So by now we know very well that our social policy orientation is pretty weak, despite all that evidence that we have on the negative health impact. But well, we need to move forward and continue, as Malik Imran has very in a great detail told us what is happening and where to go. And I would like to thank Dr. Zafar Mirza for his suggestion that he is putting on the table. I think that is an extremely important suggestion, and I remember that both the World Bank and IMF has informed our Planning Commission and Q Block that in order to implement SDGs in Pakistan by 2030 in letter and spirit, Pakistan needs $46 billion every year. So now $460 billion. And then at the same time, you look at the macroeconomic instability, particularly the financial crisis that we are experiencing. I think there what Dr. Mirza is suggesting makes a lot of sense, that the additionality of finance that he actually tried so hard, and incidentally, I was Special Secretary Cabinet and conducted that very meeting where the budget was approved and where he has informed that he actually had to stand up and grab the attention of the people there. But this 30 billion rupees was going to be earmarked to improve the the health indicators, and particularly related with smoking. So now the way our public finances have been compromised, and all the revenue which is collected, including this cigarette industry revenue, is earmarked for paying for the domestic debt. So there, if we can, with the help of IMF in particular, we can tie the additional finances that should come by the help of additional taxation that we are talking about, that we are proposing. That would be extremely important to still take care of some of the minimum social policy objective, because we all know that at the end of the financial year, this is the social sector which faces most of the cuts. So, Dr. Zafar, let's continue with that. I think in our Dr. Razia would give us the details of the policy dialogue that we are going to hold on the same subject on 3rd June. This could be one of the major proposals that we should discuss. Now, very quickly, if my screen is not moving, I don't know why. No, I'm stuck with my screen.
Dr. Sabir, if you can try, resharing, maybe that will work.
Yeah, I think that's what I'm doing, that I do it again. Okay, now can you see my screen now?
Yes, it's visible.
Yeah, okay. I think I don't go for the slideshow because that creates the problem. Now, for my presentation, I've used the University of Illinois, Chicago cigarette tax scorecard to give an idea of the regional and international comparisons. And The technical detail is that this is an aggregate of 4 components: cigarette price, changes in affordability, tax share and price, and the tax structure used. Pakistan is very bad in the region, 1.13, which is lower than India and Bangladesh. And there, out of the 4 components that are used, we have heard about the affordability from Mr. Javed as well as Malik Imran. I think that is extremely important. We have heard about indexation with the inflation. So I would not go into the details. Our affordability has remained 0. And I think there is an issue with this index also because they measure the affordability after 6 years. So that is why they show 0 in terms of affordability. Now, if you look at the regional examples, Sri Lanka had a good production base, but since 1990, the taxation has helped reduce the consumption. They are now ranked high, that is between 3 and 4. That's the second highest score, indicating an increase in price leading to decrease in consumption. And they are at 77%, which is a very good performance. Now, Bangladesh is a good example, which shows slightly different picture in the sense that in Bangladesh, the prevalence of smoking is very high. And despite levying specific taxes on tobacco and the tax revenue going up, no appreciable decline in smoking has happened. Their score, though, increased to 2.63, but the prevalence is not going down. And there, the literature says that the major reason is that the substitutes are not really taxed properly. BD is not taxed properly. So if you increase the taxes on certain brands, and if you leave the rest, then you may continue having a problem. Now, India is another kind of model where tobacco has been a major commercial crop, engaging around 45 million people. Though it has remained on the agenda, but still the tax level is low. But in India, according to a survey carried out in 2016-17, it is the effectiveness of the social awareness campaigns instead of taxation, which has made the difference. And though the score is still low than Bangladesh and Sri Lanka on taxation, but smoking incidence is going down. Now, coming to the international experience, China, as many of us would know, used to have 2/3 of the world smokers towards the end of last century. And as it was considered as an agricultural product, and state enterprises were active. So there has been some kind of an ambiguity also, but still they started very, very seriously. And now their tobacco tax is 75% of the retail price. And they have succeeded in bringing down the prevalence from 66% 25 years before to 51%. And they now have a target to take it to 46%. Their score is obviously very low, one of the lowest category. That gives us good insights about the affordability also. There is no change there despite taxation. Multiple reasons. One is that their disposable incomes have gone up lately. Then this institutional ambiguity towards tobacco companies is because of their being state-owned enterprises, and also the social custom of gifting cigarettes both for adults and juveniles also is creating hurdles. Now, going to Africa, Gambia used to have lowest prices in the region. Then they increased tax, the 3-year plan on that. And there they have reduced the import of cigarettes, and the incidence has also gone significantly down. And there they have successfully reduced the affordability by 4%, and then they are scoring pretty well. Now, another good example, Singapore has the lowest smoking rate in the world. Smoking rate, we're not here talking about the scorecard on cigarette tax. due to a stringent policy since 1970. They have a heavy taxation structure, and their smoking rates are falling now 10%. They are doing extremely well on 3.25, though lower than Philippines, but very well otherwise. So a successful governance and a continuous focus on that. Mozambique is also an interesting example that they are number 4 in production of tobacco, but they increased prices. Now they're doing better, and the consumption has gone down. Now, the last example that we have is that of Philippines, where smoking prevalence has been rather high and big disease burden also. But then they brought in this Sin Tax Reform Act in 2012, adopted Empower also, and they put a uniform specific tax on all cigarette brands of 30 per pack. And then that has brought the prevalence significantly down from 28% to 22%. The revenues have tripled. They have managed to increase the healthcare budget, and they have tied it. You see the additional revenues that they are getting from the cigarette industry. They are using those revenues to bring 8 million more low-income families into the national health insurance, and they're doing very well in their score also. Now, what do we conclude from here? The same conclusion as other colleagues have said, that there's no doubt that the FCTC is based on a solid evidence. Taxation does have an impact on incidence of smoking. It's our data which is failing us. And I think Malik Imran has amply demonstrated that. Affordability is a tricky issue. We shouldn't depend on 6-year affordability review. I'll suggest that maybe SPRC with its partners should go for an annual affordability review if we really want to index it with inflation, as some countries have already done. And then another insight that we get from the international experience is that a planned and predictable, one would say automatic increase in taxes is the best way forward. If we can gather the consensus and we say, okay, fine, for the next 3 years, so that you don't have to go through the drill every time, money bill, no money bill, jurisdiction issues and all that. Then a second last important point is that low-priced brands do create an issue. And finally, effective awareness campaigns and cultural factors are important variables. So we need to think about the sustainability of tobacco control measures in Pakistan. At the end, Dr. Razia, I would like to suggest that given the kind of interest and healthy participation and the diversity of partners that you have today, maybe this is a good time to think about establishing a new alliance to curb this menace, and maybe we can request Dr. Mirza to guide us further on that. Thank you very much.
Thank you, Dr. Safdar, for your suggestions and for your that will be great if Dr. Zafar Mirza can guide us on that, making that alliance which can work together and with the more effective way. So, ladies and gentlemen, I think we had many professional. It is our honor to have large number of eminent professionals participating in our webinar. And I personally thank them all for their presence. To benefit from their presence, I would like to invite few of them for brief comments. And we are very pleased to have Dr. Rubina Zakir. She is a public health expert and also the Director Institute of the Social and Cultural Studies, University of the Punjab. And Dr. Rubina's area of interest are maternal and child health, inequalities in the healthcare utilization, health and human rights. Over to you, Dr. Rubina, for your brief comment on smoking and inequalities.
Assalamu alaikum everyone, and thank you so much, Razia, for giving me the opportunity to have a short comment on it. As most of the speaker, they talked about economic aspect of this taxation, and definitely increasing the taxes on cigarette. This is considered as the single most effective solution which can reduce tobacco smoking. And it is for sure that it is a win-win proposition that increasing cigarette taxes result in fewer younger people starting to smoke, and it is more of the adults quitting, while at the same time providing substantial revenue to the fund, important health, as well as the tobacco prevention program. As I said, that this is a win-win proposition, but with all this positive effect, we need to see the negative consequences of increasing taxes on cigarettes. For example, tobacco price hikes may exacerbate financial insecurity among socioeconomically disadvantaged people who cannot or who do not want to quit. For this minority, taxing tobacco can become a driver of smoking by increasing the stress associated with financial insecurity. And we also acknowledge that the net positive effect will occur because overall
Dr. Rubina, are you there?
Yeah. Hello, can you hear me?
Yes, we can hear you now. Sorry, I think we lost you for a moment.
Dr.
I'm not
Rubina,
sure.
please kindly be brief. We are short of time.
Yeah. So I just want to add that while making such kind of social policy, we have to consider the social aspects as well. Because, for example, we have to see it with the gender lens as well, because it can, if it is creating financial insecurities for people who are in socioeconomic disadvantageous group, we have to see this, that women, especially spouses of chain smoker husbands, are severely vulnerable in various psychological and social dimensions. So we have to see these effects, that how we can integrate such type of issues while making social policy with regard to tobacco smoking. And definitely we have to see that what will be the impact and consequences for this increased tax. And it can also increase, it may increase other type of problems, for example, demand for cheaper tobacco use, or the black market tobacco, and as well as crime rate can be increased, because one of the studies in New Zealand, it found that the increase in the taxes, it was resulted in more store robberies, and it was leading to different problems for the community. So while making such type of policy, we have to see the social.
Thank you. Your point well taken. And due to the shortage of time, I would like to invite for the brief comment Dr. Mubashir Hanif, Director Audit, Controller Examination and Professor at HSA. Dr. Mubashir, are you there? Mr. Ahmed Ali from ISAPS. Okay, I think we can take few questions from the chat box, and also from the social media we have received. Dr. Asghar Zaidi, are you there? And Zahid Asghar Saab? Kindly mute your mic, please. Okay, so as we are moving towards the end of our session. So I would like to invite Dr. Samra Mazhar for the concluding remarks, and followed by Dr. Shehzad for the concluding. Dr. Samra Mazhar, thank you very much for joining from Ministry of National Health Services. She is a Deputy Director Technical, and she is a public health professional with an experience of more than 20 years. She is heading Tobacco Control Cell and NCDs and Mental Health at Federal Ministry of Health. She is national focal point for WHO FCTC illicit trade component, and she spearheads the development of the first national action framework for the non-communicable diseases and mental health 2021 to 2030 for the country. She is the member of National Task Force for Mental Health. Under this task force, she is specifically working for drug use prevention and other aspects of the drug. During COVID-19 pandemic, she was on the front lead of the Ministry for the Preparedness and Response activities. She is skilled in strategic planning, training, research management, and leadership. She is a strong professional in public health with a master's in public health and WHO International Diploma in Mental Health. Over to you, Dr. Samra, for your comments and for conclusion.
Thank you, Dr. Razia, and thank you for inviting and such an elaborated introduction. I appreciate and thank SPRC for arranging this pre-budget webinar. A lot of experts and have spoken, and especially Dr. Zafar Mirza, Mr. Safdar Suhail, Mr. Javed, and all others. By now, we all know the health hazard relating to use of tobacco products. So today, I suppose we were here to emphasize the enhancement of taxes on cigarettes, especially federal excise duty, which can result in decrease of consumption of cigarettes, which is a globally proven fact. So we agree that FED is not increased since 2019, whereas it should be raised annually. Recent budget, you have seen that every essential item has been taxed, but not cigarettes were included in that previous budget. So Ministry of National Health Services sends recommendation to Ministry of Finance and FBR every year during the regime of Dr. Zafar Mirza, and even during in the regime of Dr. Faisal Sultan, based on the proposals of WHO's recommendations. So we believe that a uniform taxation should be introduced on all brands of cigarettes, and but still it is not done. So I think it would be more beneficial even this webinar, although there are many experts of taxation and law, but the FBR or Ministry of Finance should have been invited, or maybe they didn't join. Even if they invite us, we invite them. So as Ministry of National Health Services is not the lead agency in the taxation policy, we all know, but we are always there to advocate like any other anti-tobacco organizations working in the country. So I advise them that they should focus more advocacy to Ministry of Finance, FBR, and the parliamentarians for increasing the FED on cigarettes, because it has to be reflected in the forthcoming finance bill or act. So these are my few recommendations, and thank you all for being here today. Thank you very much, Dr.
Thank you, Dr. Samra, for your comments. And now we are heading towards the end, and I would like to, there are a lot of questions and in the chat box, and we would like to take this to the policy dialogue, which we are going to have on 3rd June. Probably due to the critical situation, probably online. And I think we will address those questions during that time. And now in the end, I would like to invite Professor Dr. Shehzad Ali Khan, Vice Chancellor, Health Services Academy. Welcome, Dr. Shehzad, and you have waited And he is a Vice Chancellor and Dean of HSA Islamabad. He is one of the few medical doctors with a PhD in Management Sciences in Pakistan. He holds Fellowship of Faculty of Public Health from Royal College of Physicians, London, and also holds Fellowship of Royal Society for Public Health, London, UK. He has 28 years of public health related work experience ranging from peripheral level um, administration to the management of tertiary care health facilities. His professional expertise include the health system analysis, health management, policy planning, strategic planning, governance, health economics, and health financing. He has been involved and has contributed in development of several national and international strategies and policies, working papers, training manuals, and policy paper. His research work is extensively disseminated through more than 150 peer-reviewed publications. I would request to Honorable Dr. Shehzad to share his opinion and recommendations on taxation on cigarettes in the country. Thank you very much. Welcome.
Thank you, Dr. Razia. I think we had a very nice mix of economics, social policy, politics, and then technical, know-how when we had this session from Dr. Zafar Mirza. I have been listening to and following the tobacco politics since last 2 decades, and we have made quite a head forward. In 2002, when I joined Hardfile, when Dr. Zafar Mirza he was heading this the Network for Consumer Protection. He was the only voice against tobacco, and he was vocal, and he had a very strong evidence-based statements on a regular basis. And there were very few good men who were working in that cause. Now, Dr. Zafar Mirza can see he is flanked by a lot of people to support his cause, as well as to support the cause of health or public health in the country. Now there are many voices. We have had this ban on public places, the ban on advertisement. It wasn't there 20 years ago. There is a lot of laws available. The implementation is lacking, but at least the laws are there. Today, this discussion was, of course, the discussion was about this economics and politics. I still feel that tobacco is still more sort of an economic issue in Pakistan than a political or governance issue. It's all economics. When the lobby, when the mafia, and when these cartels, they join hands and they try to do anything if they have money. In developing countries, even in the developed countries also, the cartels and mafias work. So in the developing countries, they can do a lot of things. I still remember we won a grant from Bloomberg Philanthropies in 2002 and 3. And it was very difficult, even from the government, to get a letter that they will oversight and they will do this governance of that grant. And the government counterparts could not then get that, and it went into the private sector, it went into the other countries. So at that time, it was even very difficult to do something about tobacco, to talk against the tobacco industry. Now, all of us are talking about the hazards of tobacco and how to raise taxes. So to me, I think that there had been a lot of evidence. Recently, we have seen a lot of evidence about specifically the PANA. I'm missing them today. Pakistan National Heart Association has worked quite enormously, and one of their, many of their researches and many of their work has shown that the hazard of tobacco, economics of the burden of disease which is caused by tobacco, is almost 10 times higher than the revenue we get every year from tobacco. So if we get that economics straight, so for even $1 which is received by the government from tobacco industry, we have to spend maybe more than $6 in various diseases caused by tobacco. So it's very much still economical to raise the taxes and to reduce the burden of tobacco in that. We have to see that in order to gain some more success into reduction of tobacco disorders, we have to curtail the demand side. So, so the demand can be curtailed through awareness raising and a lot of other things which are already, we don't say that we should not be doing that, but other than that, this tobacco taxation and price raise has been proven very successful across the world. There is no country in the world where the demand of the cigarettes has not gone down after increase in price, because there are many young and youth which is taking out of taking cigarettes out of their pockets or out of their savings or out of their daily money they get. So if they afford 2 cigarettes now, definitely the price raise will reduce their affordability, and definitely they will not be able to use as much tobacco as it is. Similarly, a huge number of Pakistanis, they are poor or a borderline. So I feel that with the increase in price, they will switch to reduction. So we don't say that all together they will stop smoking, but gradually, if you reduce the tobacco intake, it then takes you towards quitting. So increasing the tobacco is still economically beneficial for Pakistan. Tobacco taxes raising, even if you get a slight reduction in revenue from the tobacco side with this increased taxation and reduced demand. I think that the percentage of taxes, like some of the speakers mentioned, that every year 30% taxation to be increased as per various international recommendations. So I feel that my recommendation would be to make a group, create a lobby, support the voices against tobacco. We must do it regularly. The webinars, not one-off, or maybe sometimes we do that. Do it regularly. Involve the politicians as well as involve all the people who matter to the government. So the policymakers, the civil society activists, the media people. Recently, I saw another. I was thinking of mentioning it to some tobacco forum, and I think Dr. Samara is here. Recently, I saw a new music video from the son of a very famous artist who has moved to India. I don't want to take his name, but the whole of the song was shot in a smoky environment, and everybody is smoking. So that is very common, and everybody is just watching that, and it's a very famous song nowadays. And I just saw it, and it was amazed that how this very famous guy and his son can do something like that. His mother is also very famous. So we should be very much, in connection with these people who matter to our youth, and who does have a fan following. So this is something which is very much important. So in addition to this, definitely there is no problem. There is no argument of increasing the tobacco taxation. This is recommended by all the bodies, World Bank and IMF, and you listen to Dr. Zafar Mirza, and he has all the evidences and all the global policies. And similarly, it makes economic sense. It makes political sense, and definitely it makes public health sense. So in order to improve, we must include, along with tobacco taxation, we must include all other elements for tobacco demand reduction. We must also mention those, and they can be advertisement, the ban on mentioning or filming or shooting the persons who are having tobacco in their hand, cigarettes. So this is something we should all be doing, and we should be doing it regularly. Over to you, Dr. Razia. Thank you.
Thank you, Dr. Shehzad, for your, as you rightly said, that we should combine all voices against tobacco use and tobacco, and we should combine our efforts to raise, to convince the government and the people who really matter to raise taxes and to do the other measures to make this happen, that we are out of this and we reach to our targets. That is very rightly said, and I think we are already over. Time is already. We have taken so much time on this, and thank you very much. And we have many esteemed participants who put some questions in the chat boxes, and we could not take them because of the time constraint. And I think we are going to plan, we have planned a policy dialogue, high-level policy dialogue, which is to be on 3rd of June. But due to the political situation, we may not be, we may hold it online. And I invite all the participants to join that dialogue, and so that we can come up with, and I think we will, I have seen the interest of the people, and we can extend the time and that day. And thank you very much, Dr. Zafar Mirza, and all the other speakers, Dr. Malik Imran, Mr. Javed, and Mr. Khalid Mahmood Saab, for your very, I think, insights, and for very relevant recommendations. And I think if we are working together, and we combine, and Dr. Samra, for your presence, and I think Ministry of National Health Services already is doing much, but more to, as you have mentioned, that this is the other ministries also, the FBR, and also the Ministry of Finance, who should be involved. In this seminar also, we invited very senior FBR and Ministry of people from FBR and Ministry of Finance, but due to the Doha talks, they could not spare time to attend this seminar. But we are in trying to engage them on this very important issue, and hopefully in the lead of Dr. Zafar Mirza and Dr. Shahzad Ali Khan and Dr. Safdar, I think, and Malik Saab, I think we can be successful in this very important social policy implementation. And thank you very much for your participation, and thank you for your time. Thank you very much.
Thank you, Dr. Sabha.
Thank you, Dr. Sazia.
Have a good day.
Thanks, everybody.